Masala.
And we've got
माहौल मस्त है और मौसम जबरदस्त है. मसाला रेडियो पे हम आ गए हैं. हमारे साथ में प्रिया. और आज का थीम ये है कि ब्यूटीफुल वेदर, मौसम मस्त है और ऐसे मौसम में वो गीत बजाओ जो हमें दिल करे कि हम लोग बाहर जाएं.
Yes, exactly.
गाड़ी का कन्वर्टेबल टॉप खोलें और हमारे बाल जो हैं वो हवा में उड़ते जाएं. हवा में उड़ते जुल्फें, बाल हवा में उड़ते जाएं. और क्योंकि बाल की हम क्यों बात कर रहे हैं प्रिया? Why are we talking about hair? बाल की क्यों बात कर रहे हैं?
क्योंकि हमारे पास एक्सपर्ट है.
एक्सपर्ट आए हैं, हमारे दोस्त, my friend, my मित्र, and he is here in the studio. It's always a pleasure to talk to him because he is so worldly. He goes out, he travels all over the world. He's got all this information. He's an artist. He's a musician. And he's my doctor, Dr. Carlos Puig in the studio. Welcome back, sir. How you doing?
Hello. Welcome. Thank you. Thank you for bringing me.
You've been out for a couple of months and we missed you. We missed you.
Yeah. We haven't been here since October. Can you believe
really?
that?
That's been, it's been a while. The last time I saw you was when you said that you were going to go for your last meeting. You were the president of the International Hair Restoration Society.
That's right.
And you had your last big meeting that you were going for.
That's right. And I passed the baton to Dr. Vincenzo Gambino. From Milan, Italy.
He's from Milan.
He's from Milan. He's a wonderful guy, a lot of fun.
Hair restoration surgeon?
Hair restoration surgeon, and a very good friend. So he's the president now, and I'm breathing a lot easier.
So
my emails went from 110 a day to about 30.
As the president, you were involved in, so much, so all these activities that you gotta do and you gotta keep up with everybody and, it must be a daunting task because organizing events and going out there in conventions is not easy.
Yeah, that's true. But we have a large organization and an outstanding administrative staff. And so, my job as president really focused more on designing leadership, keeping the organization focused and direction. And then, of course, as you said, traveling and representing the organization throughout the world. Last year I was in Greece, Japan, San Francisco, Chicago, Florida. I was in St. Louis.
And all this to promote not necessarily your practice, but to promote hair restoration.
Right. It's a training organization for other physicians where we train other physicians how to do the surgery, and we encourage them to do research and development within the profession.
There's so much talk about plastic surgery and new developments in 2014, and always there's something new coming up. But hair restoration is something that's been going on for probably longer than any of the other surgeries.
Well, I don't know about that, but plastic surgery is a young specialty. Well, I may have to take that back.
You've been doing it for 40 years. You've been doing it for 40 years.
Hair. I've been doing hair for 40, I'm in my 42nd year now.
Wow.
I don't look that old, do I?
Not at all.
Oh,
you don't look old.
You have a full head of hair.
Thank goodness.
And you got a lot of energy.
Don't suck up.
You got a lot of energy. You were in Japan recently.
Yes.
So what did you find? Asian hair, are the Japanese people losing hair at the same rate that we are here in the U.S.?
Yes. Hair loss is ubiquitous, and it's common throughout
Ubiquitous.
It's all over. And
if I do my GRE, I know I'll pass it now. Ubiquitous. Okay?
It's the same everywhere.
It's the same everywhere. And
context clues.
And all of the racial distributions, it's all very close to the same. Very, very close. I mean, the percentage of loss in an Oriental type of or Asian people is very similar to the percentage of loss in Caucasian or in Hispanic, whatever.
So just to give a little summary of what Dr. Puig has taught me, and also he's been on the radio so many times to tell everybody, is that hair loss has... The only thing it has to do with is genes and your family history. Nothing to do with the weather or the shampoo you use.
No. Now, that's male pattern loss.
Male pattern hair loss.
Male pattern hair loss. Females are different. Remember, females, just the trick is to remember females are more difficult.
Females are difficult because you never know what they're difficult.
You never know what they're thinking.
In every way. You never know what they're thinking.
Absolutely.
What was the word?
Ubiquitous.
Ubiquitous.
Women are the same everywhere.
We be quietest. And Dr. Carlo will be the one that will be talkative. Tell us. Female pattern hair loss. When they do experience hair loss, it's mostly because
40% genetics, just like men.
Genetic. Oh, so it is.
40% of them. Only 40%. Only 4 out of 10 have genetically inherited hair loss. The other 6 out of 10 have some other problem, and there's probably 8 or 10 different diseases out there that can cause it. Polycystic ovaries, pregnancy, thyroid disease, vitamin D deficiency. Those are probably the more common.
What is in men? What is? I've seen people now. When I used to grow up, everybody in their teens and 20s had a full head of hair. Mm-hmm. Now I'm looking at a lot. Ever since we've been in touch, and ever since I've just kind of opened my eyes to hair in general, and I'm just so obsessed with hair now. I've been looking at a lot of teenagers, a lot of young kids that are thinning.
That's right.
I never saw that in India. Back in my days, I never saw that. So the reason why it's happening now compared to the old days,
I have no idea, quite frankly. But you're absolutely correct. I had a 14-year-old in my office the other day. 14 years old.
14 years old.
Who has thinning hair, and he looks like he's going to be what we call a Class 5A Norwood. That's the guy with high sides and high back, but all empty in the middle.
Wow.
And you can see that pattern in a 14-year-old. I have a female hair loss patient who was only 17 when we fixed her problem. And then, I've got several male patients that we're treating that are in the 18, 19 range. So I don't know, but I'm seeing more and more of it in young people.
Which decade gets you the most hair loss? Is it 30 to 40, 40 to 50, 50 and over, or once you cross 50, you're good to go? Is there any such...
You mean, very few patients start their hair loss at age 45 or above. Very few start their hair loss. Most, and let's talk men first, because men and women are different. So, most men start to thin and lose their hair in their early 20s. They notice it 21, 22, 23. By 40, they've defined pretty much the pattern they're going to have. And the hair rate of loss slows down at about age 40 and stays that slow until they're about 85, and then it starts to accelerate again. So hair loss continues throughout life, but it slows down at times so that it looks like a stable pattern.
And it's most stable between 40 and 80?
That's right.
Interesting.
Now, women are different. Most women with genetically inherited hair loss don't realize that they're losing their hair till they're in their late 40s, early 50s. They show up on my doorstep 50, 52 years old.
Most women that are 50 to 60 all of a sudden go from long hair to just short hair.
Yeah, I noticed that years ago. And I don't think that it's that late. I think that the definite, when I used to say I can tell a woman is growing up and becoming a mature woman because she cuts her hair. It's an attitude change. When they go to short hair, they become more assertive. They're more
interesting,
mature. Not that, don't get me wrong, I love long hair. It's beautiful. Look at that beautiful.
I'm obsessed by hair, and I love it when Dr. Puig comes
phenomenal. That woman's hair's, you can't keep your hands off.
Priya's hair.
Priya's hair's unbelievable.
Thank you, guys.
Now, how do you know it's hair, not extensions?
Well, I don't. Not from here anyway.
Doctor, you should know. You should know.
It's all real. It's all real. Masala Radio, somebody has a question for you, Dr. Puig.
Oh.
And we'd love to get, if there's any questions, anybody wants to ask any questions, my doc keeps my hair looking fresh, looking hot. And thanks to him, I can finally spike my hair. So let me ask you quick. I've got 2 minutes. Ask me a question. question. We can take a break, and you can come back after the break and answer your question. What is your question?
My question is that I had a breast cancer. I'm a cancer survivor.
Very good. Congratulations.
Congratulations.
How long ago?
It was 2010.
Good. Okay.
And I had about 14 chemotherapies in MD Anderson.
Wow.
Right.
14
And then
chemos. Wow.
Yeah, 5 over ones.
Wow.
I was on the stage 2 breast cancer.
Mm-hmm.
I'm just glad that you're here talking to us, and you sound like you got a lot of energy, and you're all recovered.
I'm working. I'm full-time in HUB. I'm working.
Wow. Congratulations.
Thank you very much, ma'am. And the thing is that I can't grow my hair. That's what I like, like long hair, like what the Indian ladies have. Lamba, but I can't do that. Is there anything?
So she likes to have long hair. She knows the typical Indian beauty. The definition of Indian beauty would be, somebody that has long hair. Mm-hmm. And she wants to have long hair. How does she get long hair? We'll take a short break. We got to go to a break in 10 seconds. And what was your name, ma'am?
Ila Patel.
Ila, Ben, thank you very much. Stay tuned. We'll take a short break and we'll come back and answer your question. And Ila Ben, let's give her a gift certificate to Aling's Hakka restaurant.
Masala Radio.
For calling in, that's Dr. Puig's, one of his favorite restaurants in Sugarland. We're going to give you a gift certificate for calling in. We always appreciate that. Our listeners call in and get involved. So, 11, call Priya and find out how you can get your gift certificate. We'll answer your question in a few. Nice.
ये हवाएं जुल्फों में तेरी गुम हो जाए
Songs about wind blowing in the hair. And that's a wonderful song. Whoever requested the song, Priya, we got to give them a gift certificate to Aling's Hakka as well. Perfect song.
I think it was Priya.
We're going to Aling's, Doctor.
Aling's Hakka. We're giving away Aling's Hakka gift certificate. Why? Because it is one of Doc's favorite restaurants. Why do you like Aling's Hakka so much, Doc?
Oh, I love spicy food.
You like spicy food?
And it's a phenomenal blend of Chinese and Indian. It's just really good. So.
He is, we have Indianized him. We have certainly, he's gone to the temple, he's gone to the BAPS temple, he loves our culture, he loves our food, and he certainly has a lot of Indian patience. He knows, he understands the Indian hair. We're taking questions now. अगर किसी को कोई सवाल है, आप सवाल कर सकते हैं, क्वेश्चन सवाल कर सकते हैं. हमारा नंबर है 281-277-6874 और हर सवाल के लिए हम आपको कुछ न कुछ देंगे क्योंकि आप हमारे शो में एंगेज्ड हैं, पार्टिसिपेट करते हैं. मसाला रेडियो, you on the air. How can I help you? What's your question?
This is Mansi.
Hi, Mansi. Okay, go ahead.
I recently gave birth 4 months ago, and since then I've been losing a lot of hair, and I was trying to find out what I can do.
That's good. That's good. I mean, it's not good that you're losing hair. Please.
But it's good. I mean, it's great that she gave birth.
But it's great you gave birth. The baby's healthy. You're healthy. Everybody's okay?
Yes.
Good.
How's the baby's hair?
Good.
How's your mother's hair?
My mother's hair?
Yeah, does she have see-through? Does she have see-through hair? Any hair loss at all or thinning?
Well, now that she's older, yeah, thinning out a little bit, but before she was fine.
Can you see your scalp?
In the front, yes.
Good. Well, I'll tell you, you don't need to worry about your hair loss. All right, female. Okay. It's called postpartum.
He's saying you don't need to worry about your hair loss.
Yeah,
why?
Postpartum. Post-pregnancy, we call it postpartum in medicine. Hair loss is a very common phenomenon. In fact, it's probably one of the most common causes of hair loss in women. Some people speculate that 10 or 15% of the women will thin their hair postpartum after delivery. Now, there's 2 things that can cause that. First, you get thicker hair during the pregnancy anyway because of the hormone shifts that take place. And so after those hormone shifts go back to what they were before, pre-pregnancy levels, then the hair thins out and goes back to where it was before. Now, that's some of the time. There's also a common problem of temporary hair loss that occurs because of the stress of the pregnancy. That usually starts 3 or 4 months after the pregnancy. The hair stays and continues to fall out for about 3 to 6 months. And then the fallout stops and everything stays the same for about 3 to 6 months. and then the hair all grows back. Do not be alarmed about it. It's common, it's normal, and you don't need to worry about it. It'll come back. You don't need to.
In the meantime, you can just blame your husband. This is because of you.
Yeah, that's a possibility. Now, the reason why I asked about Mom is because this has never been reported in the medical literature, but, a lot of my practice is female hair loss. And I think that I see a lot of female hair loss patients who are 50 years old and have congenital female hair loss who tell me they have a history of going through this during their pregnancies. So I asked that question trying to see if there's a correlation there.
And Dr. Puig also is doing a study, research on female pattern hair loss.
Yes. We need 4 more women. More women with female loss.
He's been doing it for a while. It's a long study. And so if any women out there is experiencing hair loss, call Dr. Puig at this number, 713-974-1808. He's a friend of mine. Mention Masala Radio, you get a free consultation, and if you qualify, you might just be in this study for no cost.
Yeah,
you might be in the study for no cost.
Yeah, the study.
But you have to qualify.
Yes, you have to qualify, and it's a $3,000 treatment.
Not a financial qualification. You just have to qualify, as in you have to
have the right diagnosis.
And it's a $3,000 study, but he would do it for no cost if you do qualify. He was a president. The most recent president of the International Hair Restoration Society, past president. He's affiliated with the Baylor College of Medicine. He's always doing some research. So if you'd like to go visit him, his office, PHRC, Physicians Hair Restoration Center office, is by Richmond and Fountain View, close to Dave & Buster's.
Right. Now let's answer the other lady's question.
Thank you very much for calling in.
Thank you.
Oh, you're still there. Great.
Yeah, thank you. And let's give her a gift certificate to Aling's Hakka Restaurant. Dr. Puig's he visits there once a week. I've got some restaurant gift certificates, and we're going to give it to you. Thank you very much for calling in. I've got another couple of people holding, but let's answer the first question.
The first question. The lady had chemotherapy, 14 treatments, breast cancer. The last treatment was in December of 10, I think she said, right? About 3 years ago. 2010. It would be nice to have a little more information about what her history is and what her family history is. And most contemporary chemotherapies cause hair loss, or that do cause hair loss. It's a temporary hair loss, and the hair always grows back. In the contemporary therapies, the older chemotherapies would cause permanent hair loss. So we need to know what the mix is of medications that were used to know what the probability is that the hair is going to come back. Most of it comes back. It doesn't all come back fast. Few patients report that it comes back thicker than it was before. That's about 10 or 15% of the patients that go through the temporary hair loss of chemotherapy. What I would suggest to her is to try to stimulate the hair follicles to grow faster by utilizing 2 technologies that are available to her. The first is over-the-counter Rogaine medical therapy, and I would use the foam product. It's the generic Rogaine foam can be picked up at most pharmacies, and I'll use that once a day. That will drive the hair follicles all of the follicles in her scalp into active growing, and may accelerate the hair growth and get it to grow longer. Lengthen the length of the hair.
So that's what she wanted. She wanted
longer hair.
Yeah, her concern was long hair.
It doesn't grow longer.
So use Rogaine for women.
If you use Rogaine, it'll push more hair follicles into a longer growth cycle. The hair normally grows in a growth cycle. So that's number one. Number two is she could try low-level laser. Low-level laser will do the same type of thing, only it has a different mechanism of action. So if you use the two of them together, 5 plus 5 might equal 13.
Wow. Any more information you need, you can always contact Dr. Carlos Puig. He's a friend of ours. Free consultation if you're experiencing hair loss, men or women. He is doing a study on female pattern hair loss. It's a $3,000 study, but you must qualify, and to qualify, you gotta visit him. 713-974-1808. Masala Radio, how can we help you?
Hello, I'm Sunita.
Hi, Sunita. What's your question?
I have so much hair fall from 1 to 2 years.
She has a lot of hair falling in the last couple of years. How can we diagnose a little better?
It's really tough. How old are you?
I'm 30 years old.
She's only 30. Anything happen? I mean, is there any
stress in the lifestyle? Bankruptcy, divorce, hospital admission, intensive care, illness, pregnancy?
No, I don't think nothing has happened, but I am facing so much hair problem with me. And I tried everything, but nothing worked.
Yeah, on a radio show, it's very difficult to do a thorough evaluation.
What about your mom? How about your family history?
Yeah. Does mom have thinning hair?
I have a 4-year-old baby.
Okay, so she has a 4. What about your mom, your mother, Aapki Ma? How's her hair?
My mom has good hair.
She has good hair,
No problem with her.
Yeah, I'll tell you, this is a potentially complex problem. And, if you call the office and make an appointment, the consultation service is free.
He will take a look at
Masala
you.
Radio.
Because you're calling Masala Radio, he'll evaluate you, no cost. Visit him. You may be able to get an idea what is causing this hair loss. He is a doctor. He's a hair doctor.
My usual female hair consultations last 40 to 50 minutes. So, you can understand that drilling into the problem and finding out what's causing the hair loss may not be able to be done in a 2-minute radio spot. I'm not trying to be procrastinating here, or I'm just saying that
most likely, doctor, most likely when a 30-year-old calls and says, I've had a lot of hair falling, what could be the most likely scenario?
Oh, there's a whole bunch of different things that can contribute to it. Could be thyroid problems. Could be if she's gained weight in the last couple of years, had acute loss of weight in the last couple of years. Could be polycystic ovaries. Could be a small amount of thyroid problem and a lot of vitamin D deficiency.
Okay.
So I mean, it's a complex problem.
Could be as simple as vitamin D.
Well, yes, but usually vitamin D hair loss is not a solo thing. It often is. I mean, many times I can see just vitamin D and improving the vitamin D level helps the hair to come back. But most of the time it's secondary to, there are two things that.
But there's something happening for this hair loss. So it is something is triggering
Something's going on.
So you need to
look at it.
Get it evaluated, free consultation, stop by, visit him in his office.
Okay, thank you.
713-974-1808.
Good.
I've got time for one more call. We're off today at 5:45. I've got time one more call. Masala Radio, you're on the air. How you doing?
Fine.
How can we help you?
Actually, I am getting old and I am receding hair from my part.
So from a part where she parts, she's got receding hairline. More at the front or more in the crown? मतलब आपके आगे?
No, in the front.
In the front. पीछे कैसा है आपके पीछे crown पर?
पीछे I have enough hair.
Okay, so just in the front line is and
front
how?
Line and sideburn.
Sideburns also going. The part is going. How old are you?
49.
49.
You definitely do see me in the office.
Okay.
I mean, that is not female pattern hair loss. And how are your eyebrows?
Eyebrows is okay.
You're not losing any eyebrows on the sides?
No.
Yeah, no, we definitely need to take a close look at that and look at it because there are specific scalp diseases that cause hair loss in that nature. And so we need to make sure that that's not going on because if it is going on, first, it's a permanent loss, and number two, it takes, we may be able to shorten the course of disease and salvage some of the hair around it.
All right, thank you very much. Please visit him in the office and try to figure out what is going on. We hope that you can get your hair back. If there's anybody who can treat you, Dr. Carlos Puig can. He is an expert. His office is office number 713-974-1808. Always a very popular topic because hair, among all the things, if I put skin and hair together, my skin, my hair together, I'm more concerned about my hair than my skin. If I have acne, if I got a little line, burn mark, not so concerned, but hair I am. Dr. Puig, thank you for coming into the studio.
Thank you for having me. It's always great fun, Sunil.
Dr. Carlos Puig, my doctor, my spiky hair, courtzy of Physicians
Good job.
Hair Restoration Center. Anybody would like to get a free consultation, you can call me now, or you can call me now. I'll put you on our VIP list.
Masala